Hi everybody, welcome to another episode of Body by Ravi Plastic Surgery 101. Today I wanted to talk to you about who's a good candidate for a tummy tuck and what is the recovery associated with a tummy tuck. I just want to focus on women today, although tummy tucks can also be performed in men. We can talk about it at another time. The ideal candidate for a tummy tuck is a woman who's done having children and who is as close to her ideal body weight as possible. In certain cases, we may ask that you lose a little bit of weight in order to get a better result. And that's a case-by-case basis. It's not everybody who's necessarily in that situation. That's why it's important to be seen in person and examined to determine if you need to lose a little bit more weight in order to get the best result, because this is a commitment and we want to get the best result possible. So, done having children, as close to your ideal body weight as possible. And typically, it's somebody who has a lot of skin laxity or looseness of their skin and their tummy. This may be evidenced by stretch marks that you may have after pregnancy, the so-called pooch that's almost difficult to get rid of with diet and exercise. I get women all the time that say, well, I'm done having children, they're very lean, and the rest of their body, for many many other areas of their body, is very toned, but the skin in their tummy is very loose and they have a pooch. And they tell me that they do sit-ups all the time and they just can't get rid of it. Well, the good news is that there's good and bad news to that. The good news is that there's a fix for it. It's the tummy tuck. The bad news is that you can keep doing sit-ups all day and all night and it's never going to get better, because surgery is the only way to remove loose skin, tighten the muscles of the six-pack muscles, and also in many cases, as we talked about in other segments, perform liposuction around the areas of the tummy to give the tummy a really nice result. Now, in terms of recovery, on average, the recovery, I tell patients, is about 2 weeks where you feel quote-unquote normal again, so that you can go back to work. And in most instances, if you have a desk job, it's about 2 weeks. If you require more manual labor, that may be a little bit longer, and we can talk about that on a case-by-case basis, but it's about a 2-week recovery. The first week, you're going to have some discomfort, but there are some medications that I use during the operation to make it so that the first week is definitely more tolerable than would otherwise be. But you can expect the first week to have some discomfort. In the second week, I find in most of my patients, most of the discomfort is gone. They feel a little bit tight, which is obvious for obvious reasons. And then usually by the second week, they're ready to go back to work. Now, it's very important that you have a lot of help at home. What I mean by a lot of help, just somebody at home to kind of help you get things for you, maybe to get you in and out of bed for the first couple of weeks, specifically the first week. And just to run some daily errands and things like that for the first couple of weeks. It's very important to have help at home, because that's going to make your recovery a lot more simple and make it a lot easier for you to kind of get through that first 2 weeks transition point, after which really it doesn't end up being difficult at all. So hope that answered some of your questions today about tummy tucks. As always, I look forward to the next video. And we'll talk about different topics. There's so many different topics to talk about tummy tucks, and we can break it down on some more frequently asked questions. So thanks again for tuning in, and look forward to seeing you guys shortly.